Chapter 5, Faust and Disease Insights. The first topic in Chapter 5 is athlete's foot. I've had athlete's foot ever since I was married. I think it's my wife's fault. The podiatrist told me, put some antifungal cream on there twice a day, and I do it, and there's some progress. Then he tells me I got to soak my feet in 5% vinegar for about 20 minutes each night. So I do it, but you know, the vinegar smell, it's kind of unpleasant. It's like a douche for my feet. So our kitchen sink was broken that day, and my wife, like an idiot, she bought some distilled water for drinking, okay? You shouldn't drink distilled water. It's overly purified. The way water purity is measured is something called total dissolved solids, or TDS. The TDS on distilled water is about 0 to 2. There's nothing in it, okay? And that's dangerous because humans aren't made to drink something that purified. You know, our ancestors put their hands in the water. There was particles in there, you know, some stirred up from the bottom of the stream or the lake and whatnot. Tap water, by comparison, is about 500 total dissolved solids. If you have a reverse osmosis filter, often called an RO filter, the water is typically about total dissolved solids of about 10 to 100. So anyways, my wife's distilled water, I stole it from her, and I put it in this container and I soaked my feet in it. And I'm thinking, all right, I'm going to create a hypoosmolar metabolic hell for the foot fungi. All right, and then I'm thinking, what's the only thing worse for these foot fungi than hypoosmolar hell? I said, you know what? I'm going to create a hyperosmolar hell. So I took a whole big container of salt with iodine, and iodine itself is a bit of an antiseptic. It's part of a prep solution for the skin before doing surgery. And I poured that whole thing into the basin to soak my feet. And I did that then for like an hour. And afterwards, all the skin on my foot sloughed off. No, I'm just kidding. My foot improved a lot. But don't do this at home yourself, because I was just experimenting on myself. I got good blood supply in my feet because I'm a vegetarian. Who knows? You're probably a fat diabetic who smokes cigarettes, 2 packs a day, and you don't got such good blood supply to your foot. So don't be trying this at home and then blaming it on me, your irresponsible behavior. Anyways, I was pleased with the result because my foot improved. The discomfort and itching went away. Still a little bit of erythema, but felt much better. No longer bothered me. So I called the podiatrist up. I said, hey, this really worked, this distilled water and this, bucket of iodized salt. And his enthusiasm was lukewarm at best. He was about as enthusiastic as my wife is after she's already taken a shower for the night. Guess why? Okay, the next topic, Alzheimer's disease. Alzheimer's disease is still a mystery. I think it really should be considered a synonym for brain failure. Now they're going to tell you, Alzheimer's disease is characterized by atrophy of the temporal lobe and the parietal lobe, as well as the memory center of the hippocampus. You know what? I've seen hundreds and hundreds of MRIs for so-called Alzheimer's. They're all over the place. We don't see that characteristic of a pattern on their brain MRIs. And they used to say, well, it's because of an imbalance in the metabolism of these two proteins, the tau protein and the beta amyloid protein. There's more to it than that. That's part of it. Yeah, that's relevant. But there's more to it than that. Okay, so they used to call that, by the way, the Baptist theory. Beta amyloid protein, BAP as in Baptist, and the tau protein, which is really spelled T-A-U, but it almost sounds like the Baptist versus the tau. That was sort of the little gimmicky name for it. Alzheimer's disease, by the way, often, routinely has a vascular component to it. I can tell you, I look at tens of thousands of brain MRIs, and what do I see all day long, every day, year after year, nonstop, is tons of atherosclerosis, ischemic disease of the brain. What does that mean? The reason people's brains aren't working, the main reason, there's multiple contributory reasons, but the main reason brains are dysfunctional in people over 50 years of age, and especially after 60 years of age, is because they've got atherosclerosis plugging up the arteries in their brain, okay? Every neuroradiologist you talk to will tell you the macro, the standard dictation template for a brain MRI in a patient over 55 years of age is periventricular flare hyperintensities, most likely due to chronic small vessel atherosclerotic disease. Okay, which is a fancy way of saying their arteries are plugged up. And it could be because the arteries have fat plugging them up. It could also be because they've got hypertension related to the same type of diet that has then damaged those arteries and caused scarring of them. But either way, it's a lack of blood flow. So, what's the best way to improve blood flow? Don't smoke cigarettes and eat a plant-based diet, especially greens. Things like salads, arugula, and other salads, they increase the vasodilator within your arteries made by the arterial lining called the endothelium, and that vasodilator is called nitric oxide. So you want to eat more greens to get your arteries open. Okay, also when you walk, that helps open up your arteries too. That has a natural effect to increase nitric oxide vasodilator in your arteries. And it's made by the lining cells of your arteries, the endothelium. Produces the nitric oxide vasodilator to help open them up. By the way, that's what the medicine Viagra does in the Johnson, is increase nitric oxide in the Johnson to create that vasodilatory effect for producing an erection. By the way, what's the point of all this? What I'm basically saying is the same diet and lifestyle things that are good for increasing blood flow to your brain, they're also good for keeping the arteries of your heart open, your coronary arteries. They sort of make your whole body healthier. What's good for your heart is good for your brain. Next topic, arthritis. Well, when you're fat, it puts more weight on your joints, and you can get wear and tear arthritis, which is often called DJD. DJD means degenerative joint disease. It's the same thing as arthritis called osteoarthritis, or also abbreviated OA for osteoarthritis. A meat diet also has a tendency to include a lot of vegetable oils. The vegetable oils are high in omega-6 fats. That's a sort of a relatively bad type of fat. It's a substrate to lead to the making of a lot of inflammatory chemicals. You know, these secondary mediators. There's a phospholipid bilayer around our cells, and eating vegetable oils with a lot of omega-6 fats in them will have a tendency to increase the amount of something called arachidonic acid, which is then a precursor for inflammatory secondary mediators like prostaglandins and leukotrienes. So the bottom line is it causes inflammation. It's bad for your joints. When you go on a vegan diet, your body weight optimizes. Vegetables tend to have a relatively alkaline pH, and that tends to have a favorable effect on your joints. And the fact that they don't provide the substrate for so much secondary inflammatory mediators, it's all good. It all helps to reduce arthritis. It's definitely a positive thing to do for your health. Also, it can help reduce back pain. And what I believe is the mechanism is it improves blood supply to your spine. And so your spine is located, of course, in your back, and your lower back is called your lumbar spine. Your abdominal aorta runs down the left side and on the front of your spine, and it gives off these posterior going arteries called your lumbar arteries. And bottom line is they get a lot of atherosclerosis in them in people who eat a high-fat diet for decades, and that can lead to less blood supply to your spine and can cause degenerative disc disease and this whole cascade of worsening back problems. Now, I've previously written 2 other books on back pain. If you're interested in the details, they go all into it. But the bottom line is the same vegetarian diet that protects your heart, protects your brain. It also protects your spine, and it also has a positive effect on your kidneys. Briefly, I'm going to say something about the eyelids. Some people have infections in their eyelids, so try to avoid getting goos and gels and powder in your eyelids because you can plug up these eyelid glands. Got to be careful from glove powder. That's how I originally got it, from glove powder, pushing up my glasses when I was all sweaty doing a bunch of procedures on call. And also be careful with these hairsprays. Hairsprays are like glue. If you're spraying glue in your hair, you might get some glue in your eye. So don't do that kind of thing if you can avoid it. But if you do get this, what do? Every day in the morning and the evening, use a baby shampoo in your eye. And I recommend get the babiest of the baby shampoos, okay? It's going to be safer. Shampoos have too many chemicals in them, but the ones made for newborn babies tend to have less chemicals in them because newborn babies are fragile. So it's good to get one of those. All right, now we're going to talk a little bit about breast cancer. Okay, now women tend to be quite afraid of breast cancer, but I can tell you, I don't think I've ever met a woman that was informed on the significance of how a meat diet increases the risk of breast cancer. Here's the point. The meat that you eat will increase estrogen levels, and the estrogen from your body goes into your liver, and your liver conjugates it with other chemicals that facilitate it being excreted into the bile. The bile is the fluid that's stored in your gallbladder, and it's part of the process of digesting fatty foods. And what happens is When you eat meat, it changes the bowel flora, the bacteria that live in your small bowel and your colon, and these will cause unconjugation, so separation of the estrogen from these binding chemicals. And what does that mean? What it means is, in the meat eater, the estrogen is reabsorbed into the body. So meat eaters will have higher levels of estrogen in their bodies, and they will be predisposed to increased risk of getting breast cancer. Okay? So higher estrogen levels is associated with increased risk of breast cancer. So when you eat the plant foods, it changes your intestinal bacteria such that they do not unconjugate the estrogen, and therefore more estrogen is excreted in your stool. So basically, when you're a plant eater, you're going to poop out your extra estrogen, and you will therefore lower your risk of breast cancer. Very important to know, because you want to prevent breast cancer if you can. It's always better to prevent the disease than to treat it if you can prevent it. It also lowers your risk by having babies and nursing them. That reduces the risk of breast cancer. So again, normal biology behavior tends to improve health. What a surprise. Okay, our next topic is going to be coronary artery disease. Now, coronary arteries are the arteries of the heart. And all it takes is one cardiac problem, and it can often lead to a whole bunch of others. I can tell you, I see this all the time. A patient will have a small heart attack. And a heart attack means that some of your heart muscle tissue dies. And then because that heart muscle tissue is not dying, sometimes the patient will develop an abnormal heart rhythm. The electrical conductivity of the heart is disrupted. They'll put in an electronic pacemaker. And don't get me wrong, pacemakers tend to work pretty well. But I've seen this scenario. Little heart attack, gets a pacemaker, pacemaker's infected, the infection seizes the spine, then the vertebrae of the spine collapse, and the guy's paraplegic. And it all started because he had a small heart attack. So again, eat the vegetarian diet, you don't have the heart attack in the first place, and you don't get those subsequent problems. Now, don't get me wrong, there's a lot of very good heart doctors, and they really do a good job of treating these patients, but what I'm trying to say is, if you can prevent it by improving your diet and keeping your total cholesterol 150, that's much better than having to go the secondary path of all these treatments if you can. Okay, and that's how you do it. Keep your total cholesterol 150. What I like about total cholesterol below 150 is it's an objective way to make sure you're sticking to an adequate diet. If your total cholesterol is above 150, then there's a problem with your diet. You're doing something wrong, okay? Now, some people will say, well, it's genetic. Everybody in my family's fat. Well, it is true there are some rare, and I mean rare, genetic causes of chronic persistent high cholesterol level, but all that stuff is rare. Most of the time when somebody says everybody in my family is fat, that's because they all eat the same junk food, okay? Meat is a form of junk food, all right? And now I'll also make a point. People say, well, you know, the blue zone persons, they're not 100% vegetarian. Yes, that's true. And a little bit of meat's okay, but the older you are, the more you have to get your act together in terms of all this diet, lifestyle, and exercise. When a person is 20 years old, they can get away with more dietary indiscretions. But the older you get, you've got to really keep your act together if you want to stay fit and healthy. Okay, next topic, dental cavities. All right, now what they found is there was a dentist by the name of Weston Price, traveled all over the world, and he found lots of these persons in indigenous areas where it was very uncommon for them to get cavities. Basically, there's not as much sweet stuff out in the real world as there is when you go to the modern grocery store. If you avoid sweets and you avoid acidic foods, highly acidic foods are things like soda pop and orange juice, because that orange juice that comes from the store, it's fake, okay? And it's got a lot of chemicals in it, it's processed. You can tell it's processed. It always looks the same. Anything that always looks the same and perfect, you know there's some processing going on there. Anyways, highly acidic foods have a tendency to cause cavities. So avoid those highly acidic foods. And after you're done eating a meal, rinse your mouth off by drinking some water. Then go right and floss your teeth. That's the most important thing. And after you floss, rinse with water one more time. If you do that, you probably never have any problems with cavities. Now, some people have some bad luck and maybe you've had a previous problem. Sure, but if you follow this advice, your teeth will be healthy. And it's nice to have your teeth. Okay, you know, you can, yeah, sure, you can get dentures. Yeah, sure, you can get them all filled, replaced, all this stuff. But you know what? It's best to just keep your teeth. And that's how you keep your teeth. Avoid sweets, avoid acids. Immediately after eating, rinse with water and then floss. Now, what about brushing your teeth? You can brush your teeth, but brushing your teeth is overrated. You know, there's a lot of chemicals in toothpaste, you know. So if I'm about to, you know, talk to someone who I want to have fresh minty breath, you know, maybe I'll brush my teeth before that. But other than that, you don't need to brush your teeth too often, as long as you're doing all these other things. If I did, let's say before workout, my pre-workout meal, I'll eat some sweets, kind of get myself all pumped up to go lift weights. Then I'll brush my teeth after that. But normally I just avoid sweets. Okay, cognitive decline. Now there's a lot of things that cause cognitive decline, and it's very sad because, you know, being demented is almost like being dead. If you don't know what's going on at all, then it's almost like you're dead. So you really want to try to avoid this. And a lot of people, they really lose out on a lot of the pleasure they could be having in their retirement years because they're cognitively significantly impaired. And there's a spectrum of cognitive impairment all the way from mild to moderate to severe, but you want to prevent it. And in the book, I got a long list of things that cause cognitive decline. So number one, atherosclerosis, just means plugging up your arteries from eating high-fat diets or smoking cigarettes. Head trauma, you want to avoid anything that causes head trauma. Don't be hitting the ball in soccer. Don't let your kid hit the ball with their head in soccer. If you're going to do any of these fighting sports, don't do anything where you're going to get punched in the head, or try to avoid that because your brain doesn't like being punched, all right? You want to avoid trauma to the skull. It's not good for the brain, all right? I don't think you should be playing sports where you're getting head contact. I would recommend you don't let your kid do that because your whole life you're going to need to use your brain. If you've got brain damage from all this head trauma, it's going to make life more difficult for you. Vitamin B12 deficiency. Now, if you're a pure vegan, some pure vegans will develop vitamin B12 deficiency. I recommend in that setting you supplement with like vitamin B12 methylcobalamin, for example. But make sure you get it checked that it's actually working. So what that means is check your vitamin B12 level. So that is something that's about the only significant common deficiency that occurs in a pure vegan. And again, the blue zoners, the persons who were the 5 zones around the world where they had the healthiest people in the world, they all ate 95% or more plant-based diet. So they weren't 100% pure vegan, but they were close to it. And the author of that book, Dan Buettner, by the way, is a brilliant book. He's backed off a little bit. He used to say 95% plant-based. Now he says you should eat at least 90%. So that's a good thing to know. Alcohol, I'm not a big fan of alcohol. I recommend avoid alcohol completely. Some people say, oh, I have 2 or 3 drinks a day. I worry about that. I mean, alcohol is a tumor promoter. So you're pouring a tumor promoter across your tongue, your throat, your oral cavity, your oral pharynx. I don't think that's a smart thing to do. So that's my advice, avoid alcohol. Liver failure, that's a separate ball of wax. It's more like alcoholism. Other forms of substance abuse, don't try to solve your problems by abusing substances. I'm not aware of any of them being good for you, okay? My advice, avoid all that stuff. You're not going to fool Mother Nature. Mother Nature made us to eat plant foods, okay, to walk a lot, all the things we talked about. You can't trick Mother Nature too easy. All right, kidney failure. Check out the rice diet. We'll go into that a little bit later, but if you got kidney problems, talk to a nutritionist, talk to your doctor, look into the rice diet, the Kemper diet. You'd be amazed. The point being is rice is like a pure carbohydrate. What's the point of the kidneys? You got to excrete nitrogen in the form of urea. Okay, well, if you lower the protein content of the diet, then your kidneys don't have to do so much work, and you could stay off dialysis longer. That's what you want to do. Dialysis, it can keep you alive, but you know what? It's not an easy thing to go through, so you want to push that farther into the future. And the way you do that is lowering the nitrogen content in your diet, which means lowering the percent of protein in your diet, which means eating a carbohydrate diet, especially like rice, okay? All right, hypothyroid. Hypothyroid's become a little more common. There's a lot of reasons for that. Some people think soy contributes to it. I'm not an expert on the soy's relationship to the thyroid and thyroid function. You can talk to your endocrine doc, but I certainly would avoid it if I was worried about that. Hyperparathyroidism. That's problems with your calcium metabolism. By the way, you get plenty of calcium with a vegetarian diet. Going through this continued list of causes of cognitive decline. You could have electrolyte abnormalities, easy to check with a blood test. Lead abnormalities. Be careful you're not eating off a painted plate that's painted with lead, okay? Be careful your kid's not playing with toys that are, painted with lead paint. You want to avoid excess exposure to mercury. Be careful with those fillings, those dental fillings. They call them silver filling. They actually have a significant amount of mercury in them, so you want to try to avoid that if you can. Avoid aluminum if you can. A lot of these deodorants have aluminum in them. And in my opinion, don't be rubbing so much stuff on yourself. A lot of people are always rubbing all these lotions and creams and colognes on themselves. Who knows what's in that stuff and what percentage of it is absorbed through your skin transdermally, okay? Our ancestors, you don't gain anything by rubbing so much stuff on yourself. All right, fluoride. Fluoride is thought to not be the healthiest thing in the world. It's often combined with medications to get them to cross your blood-brain barrier. So given the choice, I think you want to minimize your exposure to that. Arsenic is sometimes, contaminating the food supply for certain types of foods. You want, to the extent you can, to avoid arsenic. Certainly keep it to a minimum. A lot of these things you can't avoid them completely, but you want to minimize your intake of them. Copper, yeah, be careful of that. You might have copper in your pipes. That's a good reason why it's good to have a water filter. I like a reverse osmosis filter, but check the TDS on it. If your water is over purified, you might want to always simultaneously eat some food when you drink the water. And don't get me wrong, when I was young, I used to drink tap water. And it had both chlorine in it and probably fluoride too, but I wouldn't make the habit of doing it if I could avoid it. Okay, so those are some of the things that can be toxic to you. I recommend also avoiding smoke, fumes, exhaust, anything that seems toxic to you, avoid it, okay? Your brain's telling you something, so avoid it. So if you're interested, there's more long list of things that affect cognitive function in this chapter. Okay, continuing with this chapter, the next topic is diabetes. Meat makes you sweet, meat and oils make you fat. Fat people are much more likely to get diabetes. Saturated fat from eating meat will increase your blood viscosity because it's making your red blood cells stick together. It's called rouleau formation, stack of coins, the French word. And then it's harder to pump those red blood cells through capillaries. Typical red blood cells about 7 microns, typical capillaries about 5 microns. So the RBC is bigger than the average capillary. It has to deform itself to pass through the capillary. And if it's stuck to another RBC, then it's even more difficult for it to push its way through that capillary. So then your blood pressure has to go up, and then the high blood pressures over time will wear out your ascending thoracic aorta, the major elastic vessel in your body. After 28 years of age, you can't really replace those elastic fibers, such that your pulse pressure will widen. That means your systolic over your diastolic pressure, like 120 over 80 is like a common number given as a relatively normal pressure. And the point I'm making is you'll start to fail those elastic fibers in your ascending thoracic aorta. That's why everybody looks good till they're 35, but after that you have to earn it. So the best thing to do is don't stress out your ascending thoracic aorta, and the way you protect it is by avoiding high saturated fat foods like meat. The guy to read, by the way, if you're interested, is a guy named Gregory Sloop MD. He's sort of this genius. The guy deserves a Nobel Prize. He really pioneered the theory of blood viscosity theory of atherosclerosis. A couple other pretty smart researchers that worked on that. Kenzie was one of the other doctors, and Dr. Cho, sort of a fluids engineering expert who worked on that. John McDougall, great nutrition doctor, recommends a vegan diet, and it's really such a simple thing. Eat the vegan diet and you'll be healthier, okay? For some reason, people are so resistant to it. It's like, just be glad you got something that could save you. I mean, that could really make you healthier. Believe me, I know. I've looked for all the answers in this vegan diet. It's incredible how powerful it is. And the reason is that's what we're made to eat. Neil Bernard, another MD, excellent on nutrition, has written a lot about this subject. Gabriel Cousens, MD, he's also written some good information on minimizing diabetes by optimizing diet. And he even has a quote, Gabriel Cousens, MD, he says, if you eat the right foods, you don't need a doctor. If you eat the wrong foods, then no doctor can help you. The best diet is a vegan, raw, organic food diet, said by Gabriel Cousens, MD. Okay, next topic, erectile dysfunction. Well, eat more plants and you'll bring back the bulge in your pants. I can't guarantee your boners will come back, but you'll certainly have good odds of them coming back. Okay? I noticed things got better for me once I switched to a vegan diet. Gosh, how old was I at that time? I was right around 40 years of age. Okay, fatty liver. Fatty liver, fatty liver, baker's man. Bake me a cake as fat as you can. I'm telling you, fatty liver is so common it's not even funny. If you get an ultrasound of the liver request and it says elevated LFTs on an outpatient who's not a drinker and doesn't have hepatitis, I can tell you this. You pretty much don't even need to look at the films. It's always going to be fatty liver. And fatty liver on ultrasound just means that the liver is more hyperechoic to the ultrasound beam than is the adjacent kidney. Okay, all day long, every hospital sees that every day in meat-eating countries. You can just dictate the report. Liver with diffuse hyperechogenicity suggestive of fatty liver. Okay, and why? Because the human gut is not made to process so much fat. The human liver is not made to process so much fat. So it just gets overwhelmed and you get all this fat deposition in the liver. And just the other day, I was joking with one of my radiology buddies. I had a patient with hemochromatosis, iron overload of the liver, and it causes a hyperdense liver on CAT scan. And I said to my friend, now, gosh, we've got the new treatment to prevent hyperdensity of the liver with hemochromatosis. All we got to do is feed him a high-fat diet, and the fat deposition in the liver will compensate for it such that we'll get a net normal density of the liver. Brilliant, huh? No, just joking around, but it's not funny. I mean, you want to avoid all this excessive amounts of meat. It just makes you sick. Okay, and fatty liver can be a very big deal. It can lead to liver failure. It can lead to the need for a transplant. People die from it eventually. I mean, most people don't have it that bad, but it can progress to that level. Frailty. Yeah, look at all these people. You know, America used to be a proud country. Men are hunters, okay? They're warriors. Now, you know, there's all these people sitting on their butt watching TV, and they're all fat and weak and sick. It doesn't have to be that way. Eat a plant-based diet, walk every day, and you'd be amazed how fit and strong people can be in their 70s and their 80s. Okay, next topic, gallstones. We kind of covered that already in a sense. High-fat diet causes gallstones. And by the way, I'm a fan of the vegetarian diet for health purposes. I don't care about animals. I don't have some philosophic thing saying, oh, we can't eat an animal, that's cruel. You know what? If eating meat would make me healthy again, or make me young again, 18 years old, I would eat it 3 times a day. I don't have any animal philosophy issues, but it's just not that healthy for you. It's simply a medical issue that is pretty obvious. When you look at the data, read the epidemiology. Don't get dissuaded by modern things based on 3 months of data. That's bogus. Look at populations that have been skinny for hundreds of years because they eat a plant-based diet. Okay, we talked about gastroesophageal reflux. A little bit about heavy metals, you know, your deodorants, what you spray on yourself or rub on yourself can be absorbed through your skin quite often, so be careful. I would recommend don't eat off of Teflon pots. Be careful, don't be scraping aluminum pots with metal spoons. You'll be scraping aluminum into your food potentially. Also, meat proteins tend to have a lot of sulfhydryl amino acid side groups, which are a little more acidic than plant proteins, such that the body has a buffering system and it has to buffer the pH, which leads to a net loss of calcium from the bone. The calcium then is excreted from the body in urine. It's called calciuria, and that's why meat eaters have increased risk of kidney stones. Kidney stones can be real painful. My father had a kidney stone. He said it was like being kicked in the back by a horse. Okay, so the way you decrease your risk of kidney stones, one way is by decreasing your milk intake and your meat intake. Parkinson's disease. You know, God gave you a nose for a reason. If something smells bad, avoid it. Okay, if you want to have a garden, minimize your exposure to herbicides and pesticides. If you want to be a hairdresser, minimize your exposure to really strong smelling hair dyes. You know, at least make sure you're in a well ventilated area. That's a good idea. So yeah, for renal failure, look up the Dr. Kempner rice diet. You'll be amazed how much that can help. As far as suicide, the thing that helps to get people to prevent from committing suicide is for them to realize their life does not just belong to them. It also belongs to their family, their friends, their community. So you can show them the Faust on Easter morning picture. You can give them a task. And if a person has something that makes them feel good, for example, Alfred Adler said, you can be healed of depression if every day you begin the first thing in the morning to consider how you can bring joy to someone else. Okay? Yeah, you should see a professional who's an expert in that area, your psychologist or your psychiatrist, but you know what? Do what you can also to help yourself. These are some ways. Soren Kierkegaard. To help another effectively, I must understand what he understands. If I do not know that, my greater understanding will be of no help to him. Instruction begins when you put yourself into the place of the other person so that you can understand what they understand and how they understand it. Okay? Carl Jung says essentially the same thing. When a patient first tells me their story, they have a catharsis. To my mind, the therapy only really begins after the investigation of what is their entirely personal story. It is the patient's secret. It is the rock upon which they are shattered. Once I know their secret, I have a key to their treatment. Carl Jung. Okay? So anyways, understanding a person can help them, reminding them that their life doesn't belong just to them. That will all help the person. I like the Dombrowski personality theory. It's a theory of disintegration and reintegration. And Dombrowski was a psychiatrist from Poland. And trust me, a lot of these personality theories are really just ways to classify people and put them in a category. Well, gee, that's nice, but it's even more helpful to explain them how to go through a difficult situation and to rebuild their life. So Dombrowski's personality theory is really good. Last thing in this chapter is vitamin D, and I recommend get your sunshine. I usually walk around in front of my house with my shirt off, and my wife yells at me, I'm lowering the property value, etc., but I don't care. That's how I get my sun. I think that's better than taking a pill, even though you might need a pill.